This is Dr. Caudill Miller with Dr. Miller's Guide to Neurology. We've been talking about common and uncommon problems in neurology, and today we're going to talk about thoracic outlet syndrome. 30 or 40 years ago, thoracic outlet syndrome was the bane of my existence because everybody got surgery. Everybody had it and everybody got surgery, and nobody got well. Thoracic outlet syndrome is very difficult to diagnose, even in modern medicine. And back then, everybody had thoracic outlet syndrome and nobody got better. The thoracic surgeons were doing a dime a dozen. So what are the symptoms? Patients get pain, paresthesia, and weakness in their upper extremity, and it's exacerbated by elevating the arm. It's real easy if you do a chest x-ray and they have an extra rib, what we call a cervical rib. And sometimes it's a curving down of the transverse process. It's hard if it's just a vascular thoracic outlet caused by the scalene muscle, but you get tingling and numbness of this finger and the ring finger. So obviously you think about ulnar neuropathy at the wrist and elbow. It's worse at the end of the day, worse with sleep. We're real lucky if they have a positive Adson's test where you check the pulse and you rotate and elevate the arm and turn the head in the direction of the thoracic outlet syndrome, and the radial pulse resolves. I saw a couple of people last month with a positive Adson's test, and it was very impressive. The treatment, you try physical therapy first. It doesn't always work. So you send them for surgical decompression, but very few people do this surgery. So you really need to find a really good thoracic surgeon. There are not many thoracic surgeons left except in trauma centers, or a real good vascular surgeon who specializes in thoracic outlet. So we do a nerve conduction study first, and we're lucky if the nerve conduction shows classic thoracic outlet and it's slow across Erb's point, the ulnar nerve slow across Erb's point. But if it's normal, you can still have thoracic outlet syndrome. So do a chest x-ray, look for a cervical rib, and then an MRA or angiogram of the brachial artery under the watchful eye of a vascular surgeon. I don't generally order cerebral arteriograms for this. I'll send them to one of the vascular surgeons here. So that's thoracic outlet syndrome. So like, comment, subscribe. More later.